Welcome to our work incentive presentation. My name is Hannah. I work at the Office of Mental Health with the NYESS unit, otherwise known as New York Employment Services System. Today what we'll be covering is what is NYESS, why employment is a good idea, what is a work incentive, SSDI and SSI work incentives, SSI work incentives, and then SSDI work incentives. Then we'll be going over some brief resources as well. New York Employment Services System, otherwise known as NYESS. NYESS is a partnership and a collaborator with these state agencies. Years ago, when the state recognized a gap in employment services across the state, NYESS was created to address this gap and forge a single point of access for all things related to employment in New York State. As I mentioned, NYESS is a statewide partnership with multiple agencies. We are a collaborative employment service case management system and a primary employment service data source. If you know of someone who wants to be connected to the Ticket to Work program, please give us a call and we can help you find a local employment network. Ticket to Work is a great program for individuals who are 18 to 64 on SSI or SSDI who want additional support when finding a job. Our primary focus is being a resource for all things related to employment. Employment is a good idea. To help everyone in normalizing the employment conversation, equipping everyone from leadership staff to program staff with the language, tools, and practices needed to make employment for our participants a standard and primary focus, we want to share that work is a good idea. It is a social determinant of health. Social determinants of health are factors in a person's life, like the conditions where they live, learn, work, play, and that impact their health risks and outcomes, including their mental health. Working positively affects a person's physical and mental health, and certainly their financial health. Additionally, individuals who are working to build their social networks are participating in meaningful life roles. It gives people self-worth and helps develop a good work ethic, and overall employment provides an improved quality of life. Finally, based on the data that has been published, individuals who are working are required less clinical interventions, whether that is for mental or substance use disorders, mental health or substance use disorders. So today we will be talking about work incentives. These are things that the Social Security Department have put in place for SSA programs to help make it easier for individuals to go back to work if they are interested in working. So first, we are going to go into the two types of SSA programs that will qualify for work incentives. So first, we have Social Security Disability Insurance Program, or SSDI. It is a program for individuals who are insured by their contributions to the Social Security Trust Fund because they have previously worked and paid taxes into the SSA insurance program. To be eligible for SSDI, an individual needs to meet the medical and work requirement. The individual must have a medically determinable physical or mental impairment that prevents them from working at substantial gainful activity, otherwise known as 1,690 for 2026. They also need to have worked and paid into the SSA insurance program and earned enough credits to be eligible. The second program is Supplemental Security Income, otherwise known as SSI. It is a program that makes cash payments to individuals who have limited income and limited resources. To be eligible for SSI, an individual needs to have little to no income, little to no resources, and either be blind or have a qualifying disability that prevents substantial work and is expected to last over 12 months or be age 65 or older. What is a work incentive? A work incentive is a special rule from the Social Security Administration, SSA, that allows individuals who are receiving either SSI or SSDI to try working and continue to receive their monthly benefit payments as well as keep their Medicare or Medicaid. Work incentives are safety nets built into disability programs that make it easier to earn money. Work incentives are meant to encourage employment reduce fear of losing benefits, allow gradual transition to financial independence, and protect healthcare coverage. SSI and SSDI work incentives. The first work incentive we're going to discuss is impairment-related work expense, otherwise known as an IRWI. This refers to the cost of items or services that a person needs in order to work because of their disability. These expenses must be directly related to the disability, and it cannot be reimbursed by another source, such as an insurance or an employer. When Social Security determines eligibility and payments amounts for disability benefits, the approval cost of an IRWI is deducted from the individual's countable earned income. This can help a person remain eligible for benefits while they are working. There is an IRWI approval request form that must be submitted and completed. This form is available through our NYESS website, and the link is provided on the slide for reference. General requirements for an IRWI. You must need the item or service in order to work. You must need the item or service because of your mental or physical impairment. You are not being reimbursed for the cost of an item or service by another source, such as Medicare, Medicaid, or private insurance. The cost of the item or service is reasonable. Some examples of what could qualify as an IRWI are supported employment services, attendant care, transportation costs, medical devices, prosthetics, work-related equipment, assistance, medications, therapies. So now we are going to get into kind of the specifics about each of those examples and how they can qualify as an IRWI. So attendant care as an IRWI. What can be deductible as an IRWI could be the cost of paying someone to perform the services for you at work, such as hiring someone to help with your personal care, like eating or toileting while at work, or helping you read or write. The cost of paying someone to help you get ready for work and to help you when you get home from work, for example, getting assistance getting dressed, bathing, preparing meals. And then what wouldn't be considered as an IRWI would be the cost of paying someone to help you with day-to-day activities if you are able to do them yourself, such as cleaning, groceries, doing your laundry. The cost of paying someone to help you care for other people also would not count as an IRWI. So medical devices as an IRWI. The cost of medical devices and prosthetics, such as like wheelchairs, dialysis equipment, crutches, pacemakers, etc., can be counted as an IRWI as long as they are medically necessary for the individual, and they would also need this medical device in order to work. But the costs of medical devices that are not related to your medical condition and that does not enable you to go to work would not be counted as an IRWI. An example, a sleeping mask, so your room is a little bit darker at night. That would not count as an IRWI or something deductible for that. Work-related equipment can count as an IRWI, such as specialized equipment and tools designed to accommodate your impairment so you can do your job, such as like using a one-handed typewriter or a screen reader. But then the cost of equipment that is not specifically designed to accommodate your impairment, such as a coffee maker or a coffee machine, that would not count as an IRWI. You can use impairment-related work expenses if you work outside of your home, and due to your impairment, you need to make changes to your exterior part of your house that allows you to get to the street or to your transportation, such as ramps or railings. If you work at home and changes, you have to adapt to create a working space that accommodates the needs of your disability, such as widening a doorway or lowering counters. That could also count as an IRWI. But it would not count as an IRWI if you work outside of your home and any changes you make inside of your home, even if there are to accommodate your disability, isn't needed because you do not need it to go to work. Or if you are self-employed and you work at home, the cost of any modifications you can deduct as a business expense rather than an IRWI. There are costs related to transportation that can be counted as an IRWI, such as if you make changes to your car so you can drive it, even if you are using the vehicle for personal reasons, such as adding hand-controlled brakes or acceleration devices. the cost of paying someone to drive you to work because your disability prevents you from taking public transportation, or if you have to use your car for business, charity, medical, or moving purposes, you may have to be able to take deduction based on the mileage used for that purpose. Transportation can be very specific depending on the area in New York in which you are getting these services. I have included a chart to help better understand the transportation IRWE for some common questions that come up around this IRWE. This chart helps determine whether transportation costs can qualify as an impairment-related work expense. If someone can use public transportation, those costs usually cannot be counted as an IRWE. However, if transportation exists, but the person's disability prevents them from using it, then taxi, specialized transportation, or vehicle costs may count towards an IRWE if they are necessary and paid by that individual. If there is no public transportation, only those who cannot drive an unmodified vehicle may deduct transportation costs related to a modified vehicle, including mileage, vehicle modifications. Again, each individual case is specific to the individual and the area which they live and work. There are other items that can qualify as an IRWE, such as the cost of non-medical appliances when circumstances clearly establish a medical and work-related need for the item. For example, an electric air cleaner for someone with severe respiratory disease who can't function in a non-purified air environment. The cost of medications for physical therapy or medical procedures, including diagnostic procedures. If you must use them to control your impairments so you can work, for example, anticonvulsant drugs or blood level monitoring to control epilepsy and antidepressant medication for mental health disorders. The cost of medical supplies you need in order to work, such as incontinence pads, catheters, bandages, or face masks. If you own a service animal that makes it possible for you to work, the cost of your animal's license, food, and veterinary care can be considered an IRWE. The next work incentive we are going to talk about are subsidies. Subsidy is a work incentive related to on-the-job support or accommodations provided by an employer that may result in receiving more than the actual value of the service that was performed. SSA uses only earnings that represent the real value of work an individual performs to decide if the work is at SGA level. A subsidy is the extra amount of wages an employer pays an individual for services over the reasonable value of the actual services performed. We deduct the value of subsidies from the earnings when they are making an SGA decision. Then our next work incentive is special conditions. It's similar to subsidies, but it is different. Special conditions refers to the support and on-job assistance provided by an employer or by someone other than an employer, for example, a vocational rehabilitation agency. Because of the support, an individual may receive more pay than the actual value of the services performed. SSA will deduct that part of the individual's wages that are not earned by that individual from their countable income when determining if the individual is working at SGA level. Some examples of special conditions are closed and continuous supervision, on the job coaching and substitution, during which the job coach performs part or all the individual's job's duties. A subsidy or special condition may exist if one of the following conditions are met. An individual receives more supervision than the other workers doing the same or a similar job for the same pay. An individual may have fewer, simpler tasks to complete than other workers doing the same job for the same pay. An individual is given additional or longer breaks than other workers doing the same job for the same pay. An individual has a job coach or mentor who helps them with their performance of some work. SSA considers the existence of subsidies or special conditions when they are making substantial gainful activity decision and only use earnings that represent the real value of the work performed. A past plan otherwise known as Plan to Achieve Self-Support, is another work incentive. It allows individuals to set aside money other than their SSI cash benefit for a specific period of time, so that individual can go to work and achieve their work goals without losing their SSI benefit. An example of this could be an individual that's been taking public transportation to work. They've been wanting to set aside money to buy a car, but they are worried about going over that $2,000 resource limit, therefore putting themselves at risk for losing their SSI cash benefit. An individual can create a PASS plan. This plan must be approved through the claim representative at their local SSA office, but this will allow that individual to set aside money and save in order to purchase a car so they can go to work and achieve their work goals and not lose their SSI cash benefit. It will not be counted against them as a resource, and it will give them the ability to save. PASS plans give individuals the ability to save and set money aside so they can achieve their work goals without losing their benefit. But don't forget, the plan does need to be approved through SSA. Examples that could be covered as PASS plans are childcare, vehicle, getting a computer, starting a business, school expenses, equipment and tools, transportation, uniforms, or other items or services needed to reach an employment goal. Now we are going to go into the specific SSI work incentives. Our first work incentive here is the earned income exclusion. It is a work incentive to use SSI program that allows Social Security to exclude part of the person's earned income when calculating their SSI payment. This helps individuals to reduce their countable earnings at the end of each month while they are working, as well as give them a better financial outcome at the end of the month. So we have two different income exclusions. The first income exclusion is the general income exclusion. SSA will ignore the first $20 of income each month, whether that is earned or unearned. And then we have the second earned income exclusion. If an individual is working, this incentive allows them to exclude an additional $65 of their earned income per month. And then after all these income exclusions, Social Security uses half of the individual's countable income to calculate their SSI payment. So the next work incentive we have is the student earned income exclusion. This allows a person who is under age 22 regularly attending school, whether that's part-time or full-time, and working part-time or full-time, to exclude some of their earnings from their income when SSA is calculating their SSI benefit. In 2026, the amount that can be excluded is $2,410 per month and an annual maximum of $9,730. So we have an example here. A 19-year-old who is attending school part-time and working part-time, they earn $1,000 in 1 month. He will contact SSA and let them know that he is going to use the student earned income exclusion for that month. He will be required to submit his wages, which he should be sending them in every month, and then send confirmation that he is attending school. He can use this benefit each month up to the annual maximum. If he earns more than the $2,410 in a month, only the $2,410 can be excluded, as that is the maximum. The next work incentive is the blind work expense. Blind work expense is only for people who receive SSI and meet the Social Security standards of blindness. The blind work expense is a work incentive that allows certain work-related costs to be excluded from SSI calculations. Unlike the IRWI, the expense does not have to be related to the individual's specific disability. The cost must be considered reasonable, meaning it is typically or customarily priced for that service, item, or similar supplies. Some examples are taxes withheld from pay, meals eaten at work, transportation costs, assisted technology, guide dog expenses, uniform, work-related equipment, and tools, union dues, or co-pays for medications or doctor's visits. And now we will be talking about continued Medicaid eligibility, so otherwise known as 1619B. Medicaid 1619B allows SSI recipients who work and earn over the allowable amount for SSI benefits to continue, allows them to continue their Medicaid coverage. If you are eligible for 1619B, this should be an automatic process. Eligibility for 1619B, you will need to be eligible for SSI cash benefits for at least 1 month. You would be eligible for SSI cash benefits except for your earnings. Your disability has not medically improved. You still need to have other eligibility rules, including meeting the resource test. You need Medicaid in order to work, and then you also need to have a gross income that is insufficient to replace SSI or Medicaid. For Medicaid 1619B, each state sets a maximum annual earnings threshold, and the average Medicaid cost in that state, individual medical needs, and the costs of long-term personal services. The income limit for New York State in 2026 is $68,654. This number does change annually, so that individual can earn up to that amount and still be eligible to continue their Medicaid benefits as long as their resources stay at or below the $2,000 limit. Medicaid 1619B may end if earnings exceed the individual threshold, if their resources go over the SSI limit, if their disability determination changes, or if Medicaid is no longer medically necessary. This is a great program as it provides a safety care net, even if your SSI check goes to zero, because you're working and earning, you can still keep your Medicaid as long as you still meet the the disability rules and need Medicaid to work. And now we'll be going into the different SSDI work incentives. The trial work period. The trial work period allows individuals to test their ability to work for at least 9 months without losing their SSDI benefits. Individuals will receive full SSDI cash benefits regardless of how high their earnings may be, as long as they report their work activity and their disability does not medically improve. The trial work period starts the first month an individual earns at or above $1,210 per month in 2026. This level may change at the start of every year. Each month, an individual earns at or above trial work level or 1,210 will be counted towards 9 months of the trial work period. If their earnings fall below that threshold that month, then it will not be counted towards the trial work period. These months do not have to be consecutive. An example of the trial work period could be Candace has been on SSDI for a long time, and she recently wanted to try out working. She got a job in January, and her first month's gross wages were $1,300. Since she earned over the trial work level of $1,210, that would count as a month towards her trial work period. The second month she worked, she received $1,200 in gross wages, which falls under the trial work level. Therefore, it does not count as a trial work period month. In March, she earned $1,250 in gross wages. Since this is above the trial work level this month, that would count towards the trial work period. The months do not have to be consecutive, as you see in the chart. In February, May, June, they do not count as towards the trial work period, as Candace's wage amount is below the trial work level of the $1,210. But the months she made at or above that amount did count towards her trial work period. Following the trial work period, extended period of eligibility begins. This begins even if that individual is not working that month. This is a 36-month period called the re-entitlement period. In this 36-month period, in which you'll still receive SSA cash benefits for all the months your earnings are below SGA level, if you continue to have a disability impairment. SGA level for 2026 is 1,690. So if you continue to earn under SGA or under that 1,690, you will still be eligible to receive your SSA cash benefit. The first time the individual earns above SGA or above the 1,690 during that extended period of eligibility time, SSA will begin the process of pausing the benefits. The first month with earnings above SGA is called the cessation month. This month will be the month SSA will begin their process of pausing their benefits. Following the cessation month, there will be a 2-month grace period. During the cessation month and the 2 months grace period, the individual will still receive their benefit payment. After the 3rd month, benefit payments will be placed on pause as long as the individual is earning at or above SGA level, the 1,690. However, if an individual earns below SGA level, they will be able to receive their SSDI payment again as long as it falls within that 36-month window. Let's continue our example of Candace. Candace finished her 9-month trial work period in January and February. In February, she began her extended period of eligibility. Candace continues to receive her SSDI payment for February, March, and April because she's earning below SGA level, below that 1,690. In May, she earned SGA level. This month is marked as the cessation month, where SSA will begin the process to suspend her benefit payments. Candace will continue to receive her benefit payment for 2 months following the cessation month. In August, Candace is still making over SGA level. She will no longer receive her SSDI payment. In October and November, her earnings fell below SGA level. Since she fell below SGA level, she's still in her extended period of eligibility, Candace is eligible to receive her SSDI payments for this month. In December, her earnings increased, and she is making over SGA level, making her ineligible to receive her SSDI payment. Our next work incentive is expedited reinstatement, or EXR. This is a safety net for people who successfully return to work and their SSDI payments are suspended or put on pause. If their cash benefit payments end because their increased earnings and within the 5 years of their earnings fall below SGA, they may be able to have their benefits started right away through an EXR request. SSA has 6 months to determine if you will get your SSA cash benefit back, and if you can request to get your SSDI benefit, and you can request to get your SSDI benefits while SSA is reviewing your request. If SSA determines that you will not get your SSA cash benefits back, you do not have to pay the money they've given you during this review period, and you can still reapply for SSA benefits. Our next work incentive is the unsuccessful work attempt. This is an attempt to either work or go back to work that does not work out within 6 months due to an individual's disability or a removal of a special condition. If SSA characterizes a period of work as an unsuccessful work attempt, that can be disregarded and the individual can be eligible for their benefits to resume. We have our next work incentives, which is the protection from the continuing disability reviews. SSA reviews disability cases periodically to see if the person's disability still meets SSA's disability rules and standards. SSA performs 2 types of these review, a medical continuing disability review and a work continuing disability review. Under a work review, SSA looks at earnings to determine if an individual is eligible for monthly benefits. A medical review determines if an individual is meeting the medical requirements to collect disability. If the person does not meet the medical requirements, SSA may stop the disability benefits. A disabled beneficiary will not have to undergo a medical continuing disability review, CDR, based on work activity alone if she or he has received disability benefits for at least 24 months or is participating in making timely progress in the Ticket to Work program. So we're going to talk about the Ticket to Work program really quickly here. And the Social Security Ticket to Work program supports career development for people ages 18 through 64 who is receiving Social Security disability benefits and they want to work. This is a free and voluntary program. It helps people with disabilities move towards financial independence and connects them with services and supports they need in order to succeed in the workforce. A benefit for beneficiaries when participating in the Ticket to Work program is SSA will suspend the continuing disability review if they are making timely progress. And that brings us to the end of our presentation today, and we'll be going over some of our resources. So this is our general list of resources. We have our nice website, past plans. If you're interested in past plans, the SSA Red Book has everything to do with Social Security and has all the ins and outs. And I Will Lose Medicaid If I Work. That is a great resource as well. And here are some more information about the work incentives that we went over today. If you have any questions, please do not hesitate to reach out. Thank you so much for watching our presentation today. We really appreciate it. Have a great day.